China's research on COVID-19. In fighting against the outbreak of COVID-19, which has disrupted people's normal life and escalated to pandemic disaster on a global scale, Chinese scientists and engineers have responded quickly in all possible ways, especially in research. The research covers multiple disciplines, including terminology, quick reporting of the pandemic, information releases, operational guidelines, epidemiology, clinical medicine, public health, genomics, vaccine development, traditional Chinese medicine, psychology, social economics, geographical environment, new technology applications, information services platforms, and public science literacy. During the early stage of the outbreak, when research was focused on epidemiology, scientists strongly proposed that cutting off the spread of the virus was the most critical factor for pandemic prevention. The non-pharmaceutical interventions, NPI, were adopted. The core measures included city lockdown and traffic control, isolation of cases, canceling all crowd-gathering activities, extending holiday, implementing mask wearing, maintaining a clean environment, and preventing hospital infections. In the article published in the Journal of Science, titled An Investigation of Transmission Control Measures During the First 50 Days of the COVID-19 Epidemic in China, Professor Tian Huaiyu and his colleagues stated that together and interactively, these control measures offer an explanation of why the rise in and incidence was halted and reversed, limiting the number of confirmed cases 96% fewer than expected in the absence of interventions. In another article published in the Chinese Journal of Epidemiology titled The Epidemiology Characteristics of an Outbreak of 2019 Novel Coronavirus Diseases, COVID-19 in China, Professor Feng Zijian's team pointed out that the COVID-19 epidemic can spread very quickly. The epidemic curve of onset of symptoms showed that the early detection and isolation of cases have prevented more infections.